So glabella, what is the glabella? The glabella is the portion in between the eyebrows that starts from the radix of the nose and continues up to the forehead where the frontalis muscle starts with its first fibers. The aging of the glabella, which is not always an aging, is more an expression part of the face, is mainly considered to be involving two main muscles, which is the corrugator and the procerus. The procerus is a muscle that starts from the radix of the nose and mix its fibers with the frontalis muscle. While the corrugator are on top of the eyebrows and will allow the the glabella to contract on itself, creating the 11 lines. All the patients are coming to either like the frowning lines, 11 lines, or angry lines, because usually when you're angry, you do this and you create these two vertical lines. The botulinum toxin is the gold standard treatment because these two muscles might be completely blocked with a botulinum toxin. We can also have, in some cases, the use of filler. As I said, the botulinum toxin is really what will give you the best result and what will bring you a very safe result. I always suggest to start with this and in case continue in the second session with the fillers. Do not start with fillers. First of all, fillers has much more complication. I'm going to explain to you later which kind of complication you can have with fillers. But also, these angry lines, these 11 lines, are mainly caused by a muscle movement. So if we don't block the cause of the lines, of the wrinkles, we will not have the best outcome. Important, and again, this I connect with the use of filler, is to know very well the anatomy, because we have structures that we need to avoid, such as the veins, so the vessels. The main complication, of course, is intravascular injection during the use of filler. With Botox, we don't have the risk, because even if we accidentally punch the vessel, what we can have is a bruise, but this will not affect the final result and will not lead to a serious complication. The two main arteries that we need to be careful of are the supratrochlear and the supraorbital. The supratrochlear starts at the radix of the nose and goes up in this direction. You can see in the picture. The supraorbital is very easy to identify because if you palpate your eyebrow, at a certain point, about 1/3 from the central part of the eyebrow, you can feel a hole in your orbital rim. This hole is exactly where the supraorbital artery and vein are coming from. And this is very important to identify this because this is a no-go for the injection of filler. I share with you some before and after pictures. Again, you can see here the patient is squinting and you can see how deep are those lines. In the second picture, the patient is still squinting, but the lines have disappeared. Most of the patients have these two lines, especially if they start the Botox in a more mature age. These lines, they're visible also at rest. And that is what annoys the patient because they really don't want to see because they can maybe accept the lines when they are frowning, but not when they are relaxed. This patient, for example, is a combination of Botox and fillers. I did the Botox first. This was a very, very severe case of glabella lines. After 2 weeks from the Botox, when the Botox is established, I always consider 2 weeks of, how can I say, waiting time, because in these 2 weeks, we will have the final effect of the Botox is at its maximum. And then from that moment, the Botox will start downgrading slowly. In 2 weeks, I can assess the patient. In this case, I injected filler in order to improve the appearance also in a resting face for the patient itself.